istilah the new normal yang ramai diperbincangkan.
Sebelumnya, Badan Kesehatan Dunia WHO menyatakan, meskipun kurva positif COVID-19 menurun, virus corona tak akan hilang dari kehidupan manusia.
Disiplin diri dan tetap mematuhi protokol kesehatan menjadi kata kunci penting memasuki kehidupan normal yang baru. Lalu apakah kita Indonesia sudah siap?
New normal is a change in behavior to continue to carry out normal activities, but with the addition of implementing health protocols to prevent the transmission of COVID-19. The purpose of this new normal is to keep people productive and safe from the transmission of COVID-19 in the midst of a pandemic. The government reminds the public not to ignore the health protocols instruction during the new normal, because the coronavirus COVID-19 is still in the midst of society. However, more and more people are starting to be negligent with the health protocols that have been implemented. People start to gather again in groups, and when they are gathering together, they don't wear masks. It's as if they underestimate the dangers of the virus that is targeting their life. Therefore, it is necessary to instill a new habit in society, such as implementing clean living and always following the recommendation that the government has implemented. In the new normal era, the government is trying to improve the quality of health service by implementing restrict people in the elevator, limiting visitors by providing a distance between visitor seats, and then temperature check. Visitors are required to wear a mask. Provide hand sanitizer and hand washing facilities in every corner of health service. And don't be lazy to always wash your hand with running water and soap, or use hand sanitizer after touching anything. Lather your hands by rubbing them together with the soap. Lather the backs of your hands between your finger and under your nails. Rinse your hands well under clean running water. And dry your hands using a clean towel or air dryer them. Telemedicine, which is the use of technology in the health sector in providing health service remotely. With the development of technology, distance is no longer an obstacle with the presence of telemedicine. A doctor in one place uses communication technology to serve patients who are in another place. Thus, patients can still benefit from medical examination from doctors even though they are far from medical facilities. For example, the use of telemedicine can be used for people who live in remote areas. In this case, documents such as photos, videos, and medical records are enough to be sent to the doctor for an immediate diagnosis. The conclusion is the new normal policy, with the implementation of health protocols constantly, make access to public service to the community limit. This can be used as an effort for public service providers to maximize public service by switching to an online system that has been running so far. This transition effort must of course be accompanied by providing education or understanding and massive socialization to all elements of society. Online system in every public service that will be accessed so that public service in the midst of the new normal life order are not disturbed and become more effective and efficient.